We address hospital readmissions and admissions basically by having clinical staff on hand all the time and having policies in place so they can assess whether there really truly is a need. We partnership with a physicians group, so our residents can either have their own primary care physician or they can go with our physicians group that comes in. So that is always really helpful in that continuum of care. The other part of that is having a good relationship with the hospital. So we have mobile x-ray that can come in, we have our hospital that'll come in and draw for lab work and those types of things. So virtually no one really has to leave the building if they don't really have to, unless it's really important. So communication is obviously a big part of it, and we have several systems in place. But one of the biggest things is, if in the event that someone does have to go to the hospital, is making sure the hospital knows how to care for them. So we use tools to do that. We use a system internally that prints out their medications and their care needs and all those things, and their insurance and their emergency contact. But then when they go to the hospital, it's staying in contact with them and communicating with the family, and it's just all about that, communicating in the best way you can. Staying in contact with the hospital as much as possible, and knowing when to say, our nurses to say that they really need to go to rehab, or they really need to go to a SNF for those types of cares, and then we'll bring them back to us. So bringing someone back too early, a lot of times hospitals may want to discharge too early, so if our nurses can get a heads up on it as quick as possible, then we're going to get them back healthy and ready to go.